I'm Mark Torbiner. I'm a board-certified dental anesthesiologist and an examiner for the State Board of California. I've been providing in-office anesthesia for over 30 years. IV sedation provides a pain and anxiety-free appointment. It also provides increased safety for the patient, because we're monitoring heart rate, blood pressure, breathing. For example, if patients are anxious and their blood pressure and heart rate are higher, we provide sedation that lowers heart rate and lowers blood pressure. We also monitor heart rate and blood pressure for patients who come in with existing high blood pressure or other medical complications. When we use anesthesia, we maximize pain control with limiting the invasiveness of the local anesthetic. Also, we provide it in a way that allows for post-operative pain freedom in most cases. We can't guarantee there will be pain freedom. We do our very best to make it not only pain-free during the procedure, but pain-free afterwards. All patients have our phone numbers to call us directly and immediately so they can reach us if they have any questions. Candidates for intravenous sedation vary. There are those who have medical issues such as high blood pressure, heart disease, asthma, patients who are very anxious about dental treatment, anxious about injections, being claustrophobic, gagging, having trouble getting numb. Those are common patients who would need or would like it. Also, any patient who's having a long procedure may want to consider intravenous sedation, as it makes the procedure go along faster and easier and maximizes post-operative pain control as well. Most patients have little or no memory of the procedure. We don't guarantee that, because there are procedures where we need our patients to cooperate a little at the end where they may have some memory. But for the most part, patients have no memory of the treatment. Since these procedures tend to be longer, 4 to 6 hours, you'll be a little groggy for the rest of the day, and you should be able to resume normal activities the next day. Most patients feel good the night of treatment, but everyone's different, everyone's an individual. But the next day, almost everyone can resume normal activity. All patients walk out of the office on their own. The answer to that is yes. Once we sedate our patients, we add local anesthetic, which allows us to provide a lighter level of anesthesia throughout the treatment. And it allows you to leave the treatment pain-free and numb. If you're numb in the first 4 hours after treatment, the peak pain passes while you're numb, making the whole 3 to 5 day postoperative course much easier. It has been established scientifically that patients who leave numb and stay numb for 4 to 6 hours afterwards have less pain over the entire 5-day course. Oral sedation has limitations in terms of what level of sedation you get. With oral sedation, we're not going to guarantee that you're not going to remember and be as comfortable. With intravenous sedation, I can vary the level from mild conscious sedation to be completely asleep, depending on the needs of the patient. So I have more opportunities available to me to make it easier for the patient. Oral sedation is useful for some patients with mild anxiety, but has limitations in terms of what you can do with that. Nitrous oxide is a mild conscious sedation agent for most patients in dental offices. It provides some pain control and some euphoria and relaxation, but has limitations in a dental office in terms of what it can do. For some patients, it's perfect. For other patients, it has no value at all, depending on the patient's needs. The level of anesthesia depends on the patient, the procedure, and the needs of the doctor. We provide levels of anesthesia from conscious sedation, where the patient is conscious and relaxed, to general anesthesia, where the patient is sleeping throughout the procedure. Most patients pick a level where they're just below consciousness but can be easily aroused. We'll use whatever level is best and safest for the patient and expedites the treatment as well.